We have Mahween ki mama, Kiran. She is one of our bereaved parents and a part of bereaved parent mentor program. She has been kind enough to provide her services for the bereaved parents who just got recently bereaved. So she provides her services through talking to them and providing the parents with support. It's been 1 year she is with us, and that's how she is. The guest we have is Komal, Dr. Komal. She is joining us on Zoom. She is also a bereaved family. She is director of Brain Tumor Foundation. She is here and is kind enough to share her experience with us. So we will get to learn how a family experiences, how a family go through the challenges when they are fighting or when their loved ones are fighting with cancer or other threatening illnesses. So without further delay, I would request Kiran, please come on stage and share your experiences. Thank you.
Who will always be forever 11 years old. When I cry, please ignore, because this is not my weakness. This is my strength. This is my love towards my daughter. She received her diagnosis on September 2019, and I lost her to cancer within few months, just within 4 months in the same year. One morning, she woke up, she wore her uniform, she was before that, she was preparing for her monthly test. And that morning she was shocked, and she began when I got to that she had when she her blood test results came, and I got to know that she had a cancer. Like only in a short amount of time, I decided this is social for her treatment. But in that 2 or 3 days, they prepared Mahveen for cannulation. They counsel me, and then which bring resilience, which helped me in overcoming my trauma. And when I moved to different hospital with psychosocial team was not available, and of course the consultant with the psychiatrist was not the first priority when we are managing the finances of the cancer treatment already. So I miss that team very much. Here I want to talk about the anticipatory grief, which we rarely talk about. People think that the grief is, but no, we started grieving when we received the news that your child has a cancer. It's a slow grinding process. It's an unstoppable journey towards death, despite all the hope that it could be different. It is not like you are expecting a stabbed and hurt, but just because you're expecting, it doesn't mean it hurt you any less. I miss the team. I miss the psychosocial department team when I saw her shaved hair. When the doctor was inserting NG tube, when she was deteriorating day by day, Mahveen passed away in just a very short period of time. But I admit that if she spent few months more, then she would need that. So I advocate that all cancer patients should receive psychosocial care and support without more burdening on the finances. Cancer is too big to deal with, because it has more complexities of emotions and the invasive treatments. And this should be not for the patient, this should be for the whole family. Because when I was reading a research which was held in the local hospital in Karachi, and out of 100 mothers, 78% were diagnosed clinically depressed when the child was during the treatment. So also, I want to, there was always a need to, and also I know the doctors are overburdened, but also I advocate that doctors communicate effectively with the cancer patients and families, and also the choice of words must be sensitive. So this is my advocacy for the raising awareness for my daughter and for cancer treatment. That's it. Thank you.
Thank you. Now I'll have your questions in the panel discussion. How was your experience? What helped you in the journey? If you want to read out anything, okay. Okay. Thank you so much, Kiran, for sharing your experiences and shedding light on the importance of psychosocial support you had, and you wish for other parents who are going through the same journey. Now, I would like to request Dr. Komal Komal Syed to share her experience with us. Over to you, Dr. Komal.
Assalamu alaikum. Thank you for having me. Just one clarification. I'm not a doctor. I'm just, I guess, a caregiver and a family member. I'll just share my screen if that's possible. Just give me one moment. Please let me know if you can see my screen.
Yeah, we can see your screen, Komal.
Okay, great. Thank you. Well, Assalamu alaikum and hello everyone. Thank you to Dr. Fyeza from SickKids Hospital, Toronto, and Ms. Hasma, to you from Indus Hospital in Karachi for inviting me to speak as part of your course today. My name is Komal Syed, and I'll walk you through my unique personal journey as a caregiver, with the hopes that it will encourage and inspire medical professionals and healthcare teams to provide holistic support to patients as well as their caregivers. I'll also be sharing a few pictures on the screen to just make the experience a little more personal as I speak. So I'll start with autumn 2012. I remember these few months so clearly that it feels like they happened just yesterday. My husband Taha loved traveling, and he planned a vacation for us to Turkey on 22nd October. However, a week before our scheduled departure, he started having severe headaches, and 2 days prior to our travel date, he was admitted into hospital for further diagnosis. The neurologist diagnosed migraines, but Taha's sixth sense told him that this was something else, and he insisted on getting an MRI. On October 25th, 2012, Taha, who was just 36 years young, had a third ventriculostomy with a biopsy that determined he had brain cancer. 2 months later, on December 19th, he went on to have an 8-hour craniotomy to debulk the tumor, and the biopsy from this surgery confirmed that not only did Taha have brain cancer, but he also had the most aggressive kind there was. Taha was diagnosed with glioblastoma multiforme, a grade 4 level brain tumor. As a young couple, only 3 years into our marriage, it came as a sudden jolt to us that someone as young and healthy as Taha could be diagnosed with brain cancer. Words cannot do justice to Taha's larger-than-life personality. He was smart, he was confident, he was humble, he was extremely social, and more than anything, he was a lot of fun. So seeing someone like him being diagnosed with a terminal illness that takes over one's mind and body was simply devastating. It was like torture for myself and our families, and I cannot even begin to imagine how it made him feel. Despite this, the strength that he exuded and his positivity was enough to keep us all positive. Needless to say, after this diagnosis, our lives came to a standstill. The next few months was a whirlwind of events for both of us. Taha tried to cope with the changes in his mental and physical abilities and how that impacted his work and lifestyle. And I tried to balance my full-time job alongside my caregiver role at home. And in doing so, I realized that my priorities in life quickly started to shift. My husband's journey as someone battling a terminal illness, coupled with my journey as a spouse and primary caregiver, put us center stage into a life and world that we'd never been privy to. After his diagnosis, we frantically tried to educate ourselves about the disease and search for the best treatment available. Our aim was to remain positive and hopeful, and we managed to have some very special moments of joy with family and friends. But I'd be lying if I said that there were no low points. We experienced firsthand the immense care and the extreme challenges of navigating through the healthcare system, both in Pakistan and abroad. We encountered reputable doctors who tried to scare us into treatment by saying things like, if you don't want to live more than 2 weeks, then you can skip the treatment. Or things like, your treatment will continue till your body can physically take it or you can financially afford it. These statements are horrible for anyone to hear, and the thought that it was said directly to the patient was even more horrific. I'd have to spend countless hours post appointments to build up Taha and my own hope and positivity. We finally opted to change our doctors, and as this mental health stress, as true as it might be, was not going to help Taha fight his illness. Once we changed our team, we were actually blessed with neurosurgeons and oncologists who would go above and beyond their call of duty. These doctors are not only a source of strength and power for us, they were also sort of side hustling as therapists for myself and our family members, making themselves available to speak to us, reaching out on their own after treatment ended to check in on us, and giving me confidence that we've tried every possible treatment to cure the disease. These are just a few examples of the exemplary work ethic to ensure the patient and family were staying positive despite their busy schedules. After consulting with family and the doctors 2 years after Taha's diagnosis in late 2014, as this disease started progressing, I took a sabbatical from work and I focused all my time and effort into Taha's care. And this was by far the best decision I've ever made, as it allowed me to dedicate myself completely to my husband who needed me most at the time. Our journey through his illness was overwhelming and erratic, as is the case for most people battling a GBM. But in hindsight, I realized that our journey was also extremely isolated. We were very fortunate to have an exceptionally strong network of family and friends who were always there for us, and thanks to them, we had many high points despite the grave nature of the illness. However, we knew absolutely no one who was going through something similar to us. My husband's medical team at the University Hospital in Karachi were beyond fantastic, and as mentioned earlier, they went out of their way to support us as much as they could. But again, outside of medical and personal support, we had no form of non-medical support from a brain tumor community per se. By early 2015, Taha's physical faculty started giving way. He started having memory loss since chemo started, but in 2015, it was to an extent that he would not recognize me. By mid-2015, Taha was hardly speaking, and we could hardly communicate with him from then onwards. It almost felt like this change happened overnight, and we had no idea to expect it. Slowly, it started sinking in for me. As much as I wanted to stay positive and have high hopes, I started acknowledging the possibility of the worst. It was like trying to maintain a fine balance, knowing loud and clear what might happen, but also at the same time tricking my mind into believing there was still a chance of survival. At this stage, anticipatory grief started to set in for me, as Ms. Kiran was also saying earlier, and I started preparing my mind for the inevitable. A dear friend actually guided me to start therapy, and I'm so thankful for that advice as I took it up and I started seeing a therapist to process all my thoughts. Unfortunately, 3 years after diagnosis in November 2015, Taha passed away, and I lost my dear husband to brain cancer. As Taha's primary caregiver and spouse, I learned a lot of things over time. And now that I look back, I think I coped fairly well given the fact that I didn't have much guidance on what to expect. As a caregiver, I learned a few things, and I'd like to just maybe share a few of them here because it's been 7.5 years since then, and I've had, I guess, a lot of time to process my thoughts. So first thing I'd say is, for caregivers, make sure that they identify a primary caregiver. And I think medical and healthcare professionals can guide caregivers to do these things. So make sure to identify a primary caregiver. Initially, when Taha was diagnosed, we had multiple caregivers and multiple decision makers in the family. As much as it's important to take into account everyone's view and opinions, it's extremely important to know what the patient wants and have a single point of contact when communicating with the doctor's team and other support functions. This also makes for effective decision making. The second is be the voice of the patient, identify the needs and actively work towards addressing them for the patient. Proactively try to understand your loved one's choices when it comes to treatment and death. Address difficult questions so you're not left wondering what your loved one might want in case they're not able to communicate later. Thirdly, play the role of an administrative assistant. To be honest, as a caregiver, I had to be super organized, make sure I was the one booking appointments, be on top of paperwork, understand the reports when next things were due, be able to contact his work, communicate with them, let them know that he'll be off, won't be able to work, contact insurance, manage all the documents, prepare questions in advance and know how to take notes during appointments, especially since most hospitals will not let you record your appointment with the doctor due to, I think, confidentiality rules. And then another thing within this is also ensure they're joint signatories on patients' bank accounts and other legal financial matters. I wish someone had told us this before because it hit us when Taha stopped being able to sign. And we realized that I wasn't joint on his account. So we had to go to his bank manager, and luckily they added me. But to be honest, it would have been great to know this early and do this much earlier. Fourthly, I'd say as a caregiver, keep on researching, understand the treatment well, ask questions, seek second opinions, join groups to meet other people going through similar experiences, be prepared for possible scenarios in the future. Fifth, it's important to care for oneself. It's so important to do this, but it's usually often ignored and underrated. Caregiver burnout is real. And I remember make sure I stepped out of the house for 1 hour a day to either work out or go for a walk, but I'd also feel very guilty. And there's grief, but then there's also guilt. I'd feel like I'm being selfish when I take care of myself. And finally, number 6, live in the moment, because it's so hard to do, but it's so important because life is worth living and you don't know how much time you have with your loved one. After losing Taha, I had months of guilt and I used to have panic dreams that would wake me up in the middle of the night where I felt like maybe I could have done something, maybe I could have saved him, maybe if I did something differently, things would change. And I remember I spoke to my therapist and I also spoke to, I think his physiotherapist used to come every day and he explained to me that you did everything you could do. And I had to like really convince myself of that to get over that guilt. I'd like to, share a bit about, my thought process after Taha passed away. So as I became a young widow trying to refit all these scattered pieces of, I guess, what felt like a jigsaw puzzle that my life had become, I came to terms with where life had brought me, and I tried to realign my internal compass to do what matters most to me. I relocated to Canada to be with my immediate family, and I started volunteering countless hours at the Brain Tumor Foundation of Canada to support those still battling the disease with the hope of giving back in some small way. Volunteering there opened my eyes to the wide array of support elements that existed for brain tumor patients and caregivers, and allowed me to see firsthand how they can improve the experience of those impacted by the disease. I then started to wonder how it would have been for Taha and myself had these support elements been available for us during our journey. This thought eventually brought me to the idea of establishing such a support organization in Pakistan, which services all those impacted by brain tumor in the country today. So, the Brain Tumor Foundation of Pakistan was set up in memory of my late husband, Mohammed Taha Rafi. Our mission is to reach every individual in Pakistan impacted by a brain tumor with education, information, non-medical support, to take the burden off medical professionals and and to be a brain tumor patient advocate, bringing the rights and needs of brain tumor patients to the forefront. Our vision is to drastically improve the quality of life for those impacted by brain tumor in Pakistan and to help in eventually finding a global cure for the disease. Moreover, it is my personal goal to improve the journey of those still impacted by brain tumor in Pakistan with the aim of making their journey easier than it was for Taha and for me. Thank you so much for listening to me today and to listening to Taha and my personal story. Please keep Taha in your prayers. Thank you. Thank you.
Assalamu alaikum. This is Dr. Fyeza here. I think maybe there's a connection issue at the other side. Can you hear what I'm saying?
Yes, I can. I believe Dr. Asma just messaged saying they're experiencing internet issues. I hope you were all able to hear me on Zoom.
Yeah, I think we heard you really loudly and clearly, and I just I put something in the chat, but I just wanted to thank you and Ms. Karen also for sharing your really beautiful sort of descriptions of your stories, and thank you for sharing all those really personal details. And
thank you for having us.
I was wondering if maybe I could start with the first question, if that would be okay. I think both you and Karen both mentioned that you experienced anticipatory grief. And I think maybe as health professionals, we think that grief starts with, with the death of an individual rather than before the death. And I was just wondering if anyone ever talked to you about your anticipatory grief that you were experiencing, and if that, during your journey, and if maybe that would have been helpful for the health professionals to do that.
No, no one did. In fact, I didn't even know that term existed till very recently. And then I connected that maybe I experienced that. To be honest, I didn't even tell anyone because I felt very guilty that I was already starting to think of the worst case scenario. I remember when he did pass away, it was almost like I knew what I had to do because I had replayed it in my mind so many times. But no one had spoken to me about it.
Thank you so much, Komal. We back with our internet connection. I wish that you had opportunity to talk about apprehension, grief apprehension, so you could have the power to control over the situation and to deal with the situation in a better manner. I'm sorry we had technical glitches, and I hope these are resolved now. We were able to get your presentation, get your experiences. That was very worth sharing experience. I really like the idea that how you talked about taking administrative role as a caregiver, how it helped you to, again, navigate through the process. So I have a question. We have over here, our audience is most of the doctors and nursing staff. And when you are dealing with such conditions which are chronic illnesses, you get to experience a lot of with them as a nursing staff with healthcare team providers. What do you think, and what would you like to talk about? I have same question from Kiran as well. What were the helpful things with healthcare team providers, with healthcare team? What do you think? How they guys helped you to get through the journey?
Yeah, I guess I could try to go first. It's been 7.5 years, so my memory is a bit
Yeah.
blurry, but I remember more clearly my experiences with the neurosurgeons and oncologists, I'll be honest. But I think with the nurses and the staff that was available, it was primarily during my husband's end of life care when it was extremely uh, helpful. Like with just in general, like I think with the nursing staff being extra compassionate or extra kind. I remember some of the times, like when he'd be admitted to hospital, I could share maybe some extremes, right? And some of the times when he'd be admitted to hospital and they'd be moving him just on the bed from room to room or to the operation theater, I'd be obviously going with them and like walking with them side by side, and sometimes it was just like very rushed and knocking the bed here and there. It's like, there's a patient here, he already has a headache, please don't knock the bed around while you're moving it. So those things would happen, but then the other staff who was extremely kind and constantly updating me on when the doctor round will happen, or making sure I'm aware of what's coming up next. I think those things are very helpful. Or to be honest, even seeing the same face when you go for chemo or for those blood tests, to be able to see the same face and that nurse recognizing the patient and recognizing you as the caregiver is also important. So when staff keeps changing, it's I guess feels very impersonal when there's always a new face.
Oh, that's great, right? That's a different experience, I guess. When you said that, having have to deal with a different person every time and have to share similar things with a different person, and most of the time that could hindrance your growth, your process, and to me, and maybe to have the experience that is more personalized. So yeah, that's really very good topic. I have Kiran. I would like to have Kiran to answer the same question. Um, uh, I would like to address that English is our second language. So Kiran would be more, I guess, I want her to share her experience in a like very more, yeah. So she'll be sharing her experience in Urdu. That's our language. So I'll be translating, or maybe I'll be summarizing her responses for the audience who couldn't understand Urdu. So please, Kiran, आप बताइएगा कि आपका एक्सपीरियंस कैसा रहा और हेल्थ केयर वर्कर्स जो इस पूरे जर्नी में आपके साथ होते हैं, उन्होंने इस पूरे प्रोसेस को आपको इसमें से गुजरने में कैसे हेल्प की?
मेरा जो ओवरऑल एक्सपीरियंस था वो बहुत अच्छा रहा था कि वो अपने तौर पे, बिकॉज उनकी उस तरह ट्रेनिंग नहीं होती जैसे कि जो साइको सोशल टीम होती है उसकी ट्रेनिंग हुई होती है, लेकिन उसके बावजूद भी उन्होंने बहुत ज़्यादा मेरे लिए, सिवाय अगर कोई एक दो की अगर हम बात करें, उसके अलावा ओवरऑल मेरा एक्सपीरियंस बहुत अच्छा था. मतलब मैं थैंकफुल हूँ कि वो उस डॉक्टर की कि जो मेरी बच्ची के लिए उनकी एक आंख से आंसू भी टपका। जो मेरी बच्ची के जब वो लास्ट ब्रेथ ले रही थी तो तमाम डॉक्टर्स जो हैं वो उसकी बेड के इर्द गिर्द खड़े थे, और जो नर्सेस थी जिन्होंने टाइम गुजारा था वो मिलने के लिए आ रही थी। तो ये वो बातें हैं जो आपको पूरी जिंदगी में याद रह जाती हैं। तो ओवरऑल मेरा एक्सपीरियंस बहुत अच्छा था। और अगर हम जो ये सर्विसेज हैं उसमें रिफ्रेशर कोर्सेज भी ऐड करें कि हम उनके लिए भी, जो पैरामेडिकल स्टाफ है, जो डॉक्टर्स हैं, वो भी एक मजीद उनको एक रिफ्रेशर कोर्सेज करवाएं, तो ये मेरी सजेशन है कि और जो है वो हेल्पफुल रहेगा, कि कोई जो है वो रिलेशनल टेंशन नहीं आएगी पेशेंट और जो है केयर गिवर के दरमियान।
और कौन सी ऐसी चीजें थी किरण जो आपको लगता है कि अनहेल्पफुल थी, और जो एरियाज ऑफ हमारे इम्प्रूवमेंट एज अ हेल्थ केयर प्रोवाइडर्स हो सकते हैं, जो कि एक पेरेंट एक्सपीरियंस कर रहा होता है, बट बिकॉज वो इस सिचुएशन में होते हैं तो वो एक तो एक्सप्रेस नहीं कर पाते, लेकिन उनके वो प्रोसेस को कॉम्प्लिकेट कर देते हैं।
मुझे लगता है बाज़ दफ़ा लैंग्वेज होती है जो कि वो बैरियर पैदा करती है। लिंग्विस्टिक आपकी बहुत ज़्यादा जो है वो रोल प्ले करती है कि आपका जो है केयर गिवर जो भी है वो आप बात को किस तरह आपसे कम्युनिकेट कर पा रहे हैं, कितने इफेक्टिवली कर पा रहे हैं। बिकॉज जो ये जब जो केयर गिवर्स होते हैं, जो स्टाफ होता है, उसके लिए तो ये एक नॉर्मल, उनके लिए रोजाना की बात होती है, लेकिन जो भी कोई आता है उसके लिए इंडिविजुअल एक्सपीरियंस होता है, और वो जो है उसके लिए एक फॉरेन वर्ल्ड होती है। और वो अचानक ही जो कैंसर तो ट्रीटमेंट ऐसा है कि अचानक आपको जो है वो एक दिन में आप जो है एक नॉर्मल वर्ल्ड में रहते हैं और दूसरे का आप न्यू वर्ल्ड में दाखिल हो जाते हैं, और जो एक अनस्टॉपेबल जर्नी, आप रिवर्ट बैक नहीं कर सकते उससे। और आपके लिए हर नया दिन जो है वो कोई नई चीज लेकर आ रहा होता है।
थैंक यू। I have sure.
For that, she's told now that there is every time when you admitted in the hospital, multiple caregivers or healthcare professionals, they come and they're different every time. You know, that is a big trouble for a mother, because every time when you're telling the story to the healthcare provider and the child is particular child or any care the person patient is lying down, it's very difficult for a caregiver to tell the story every time to everyone. You know, and that increases the pain also. So what I suggest to the healthcare provider, they should communicate with each other, the proper communication before coming to a patient, so that you know it will be less trouble for the patient also.
That's very good point. To have that history available to the healthcare teams before they are talking to the caregivers, so they don't have to reshare it and kind of re-traumatize their experiences. That's really very good.
You know, when you are telling every time the story, the trauma to the patient and also to the caregiver.
Right, that's really good point. So I have one more question from you, Komal and Kiran, is that that's why healthcare providers. What about the community? What about the social support you guys had, and you think how they were helpful and unhelpful during their journey? So Komal, would you like to go first?
जी बिल्कुल. So as I mentioned as part of my story, our experience I thought was very isolated. We didn't know anyone who was going through the same thing at all, right? So we knew the medical professionals and our own family, which of course is not going through the same thing. So we didn't have a community per se. And to be honest, that was when I came here and I started volunteering with the Brain Tumor Foundation of Canada, that's what I saw in the support groups, where people come together, they can ask each other questions, they can share suggestions or recommendations based on their experience. And that's actually one of the things we do now with our foundation. We run monthly support groups. But personally, for me, that was one of the biggest pieces. It was just felt alone. And it was, Taha and myself were together. But then when he started becoming so unwell that I couldn't communicate with him, I was alone, basically. I was trying to figure a lot of things out on my own.
Yeah. Thank you so much, Komal.
मेरा जो एक्सपीरियंस है, मुझे लगता है बहुत ही कम लोगों का ऐसा एक्सपीरियंस होता होगा, क्योंकि मैं सिंगल पेरेंट थी। हमारी 3 की फैमिली थी, मैं, मेरा बेटा और मेरी बेटी। और बेटी हॉस्पिटल में आ गई और वो 4 मंथ्स जो है एडमिट रही है, और हम ऑन एवरेज हम 2 और 3 डेज हो के कि हम घर गए होंगे। और मैं मुस्तकिल हॉस्पिटल में उसके साथ थी। मेरा बेटा जो है वो मेरे लैंडलॉर्ड के पास था, और मेरी कोई मतलब नजदीक की फैमिली नहीं थे, मेरे पेरेंट्स की डेथ हो चुकी है ऑलरेडी, मेरे मैं जो हूँ कोई सिबलिंग्स नहीं है मेरे, तो मेरे लिए जो है वो एक तरह से इस तरह भी ट्रॉमेटिक है कि ऑलरेडी जो मेरे बच्चे थे वो इतने मेच्योर हैं, सिंगल पेरेंट्स के शायद हो जाते हैं, कि वो मावीन ने अपनी बहुत सारी चीजें, मुझे लगता है कि वो मैं, क्योंकि मैं जो हूँ अपना, मैं बहुत ही ओपनली ग्रीव करती थी, और मतलब मैं एवरी डे आई क्राई आई थिंक, तो मुझे लगता है कि वो इसीलिए कि वो जो है मामा ऑलरेडी परेशान है, तो वो अपनी चीजें एड्रेस नहीं कर सकी मुझसे। उसके अलावा मैं मेमोरीज नहीं बना सकी उसके साथ, क्योंकि मुझे लगता था कि हम अभी घर चले जाएंगे, हम अभी घर चले जाएंगे। उस वक्त आपको लगता है, वो यही है ना कि आपको एक खौफ तो होता है कि कुछ ऐसा ना हो जाए, लेकिन हमेशा आपके पास होप होती है कि आपका बच्चा कहीं नहीं जाने वाला, बिकॉज आपकी डीप इनसाइड तो होता है कि ऐसा थोड़ी हो सकता है कि आपका बच्चा पहले चला जाए और पेरेंट्स, मतलब ये तो नेचुरल फील होता है। तो सब कुछ डायग्नोज होने के बाद भी आप इसको एक्सेप्टेंस के फेज में नहीं आ रहे होते। तो मेरे लिए जो है अभी जो ग्रीफ से हीलिंग के होना जो है वो इसलिए ज्यादा मुश्किल मुझे लगता है कि मैंने जो है उसके साथ मेमोरीज नहीं बनाई, बहुत सारी चीजें हैं जो कि रह गई, जो कि मैं उस वक्त करना चाहती थी और वो मैं नहीं कर सकी, और ये फिर आइंदा आखिर दम तक जाएगा मेरे साथ।
Thank you so much, Kiran. So having your experiences, I'm thinking about the hope element. We have our session on hope. Hopefully, next session, maybe or after that. So we share our as a healthcare team providers perspective that how we can incorporate hope. I would like to know, Komal and Kiran, from you. So what do you think that as a healthcare providers, how we can incorporate hope, because we know that we are going to share difficult news with you, right? Very difficult news or bad news with you, and we as a healthcare providers, we are afraid on our own ends, and that's like not a very good or maybe a very positive experience to share. But what do you think as a family, as a caregiver providers, what you could count as a sentence of hope?
Kiran, आप पहले जाना चाहेंगी या should I go?
ठीक है, मैं करती हूँ। मेरे लिए तो होप ये थी कि मुझे जो वहाँ का पैरामेडिकल स्टाफ था वो मुझे उन बच्चों की स्टोरीज बताता होता था जो कि सरवाइव कर गए हैं, तो वो मतलब इस एक तरह से मुझे ना बड़ी होप उनसे मिलती थी। और उसके अलावा आप में जो है, जब आप ये एक्सेप्ट कर लेते हो ना कि आपके बच्चे को, पहले तो आपको एक्सेप्टेंस फेज में नहीं आते हो कि क्या आपके बच्चे को कैंसर भी हो सकता है, लेकिन जब आप ये एक्सेप्ट कर लेते हो कि कैंसर है, तो फिर आपके अंदर बहुत रेजिलियंस आ जाती है। आप कहते हैं बस हो क्या ना, अब क्या है, अब तो मुझे इसका ट्रीटमेंट कराना है और ये सही हो जाएगा। तो आखिरी वक्त तक आप एक मिरेकल के इंतजार में रहते हो और आपके पास होप ही होती है जो आपको सहारा दिए होती है।
Thank you, Kiran.
From my end, I would say that I think we really appreciated when our doctors were clear with us and communicated things very pragmatically. However, at the same time, not bluntly or brutally. So one example of a blunt and brutal pragmatic communication is one of our first oncologists, Taha, had asked him directly that, doctor, how long do you think I'll have chemo? And he said, till your body can physically take it or you can financially afford it. Like, that's very practical, but it's not at all empathetic or diplomatic, right? So to say that to the patient made him lose hope completely, actually. But then on the flip side, with our neurosurgeon, when we trained doctors and the neurosurgeon we had, he would spend a lot of time to explain every piece of how the surgery will take place. He would draw the diagrams and explain that this is exactly how we'll do the treatment and this is how we'll do the surgery. These are the options. This is what I expect. Making us part of that, kind of making us feel like we're part of the decision making, and then even post surgery, bringing the whole family together, spending 15 minutes explaining what happened and how the surgery went. I feel like that's really important in terms of communication. And to the point of hope, I remember these doctors would reach out to me directly to tell me, even after surgery was done, even after chemo was done, both the oncologist and neurosurgeon had reached out to me and said, we'd like to speak to you. And I was wondering, why do they want to speak to me? He's in palliative care or end of life care now. And they contacted me just to tell me that we want you to know that you have done your best. You have tried everything. And we would like to tell you that every possible treatment that was, possible for Taha, you tried it. And we just want you to know that so that you don't ever feel guilty. And I mean, it was maybe preparing us for what was to come, but they did it in such a nice way that it helped us deal with the reality.
Oh, that's so great. I really love the idea that how they planted a seed of, the upcoming event that's obviously not going to be a pleasant one, but how they prepared you by encouraging you. And, with my experience that I have heard a lot about parents or caregivers guilt, and having that statement listened to, that you have done your best, this really gives you strength that, like kind of wipe off, not very like 100%, but that's kind of relieve your guilt in your journey. So I have one more question again. That's related to bereavement experiences. Over here, we have nursing staff, we have our doctors. We do emphasize on bereavement services. We do emphasize on bereavement support we could provide. How do you see it? When it is being provided from a hospital or from your your caregiver, sorry, healthcare team. So how do you see it, and what do you think how important it is?
So you mean post?
Post death.
So I didn't actually receive that at all. So I don't know, maybe it didn't exist at Akhan at the time, but we didn't like have any sort of bereavement support at all. It was primarily just ourselves dealing with the loss. So to be honest, I'll tell you, I still don't know what bereavement services entails because I never experienced it myself. So unfortunately, I don't think I could share much.
Right. Thank you so much. Kiran, would you like to add something on bereavement support?
bereavement support मुझे बिल्कुल नहीं मिली थी क्योंकि मैं एक्सपेक्ट कर रही थी कि जो इसके ऑन्कोलॉजिस्ट हैं मे बी वहाँ से कोई फ़ोन कॉल या फिर कोई लेटर या कुछ इस तरह आएगा बिकॉज जब आप वहाँ मुस्तकिल रह रहे होते हैं तो आपको जो है ना आप जब दाखिल होते हैं तब तो फॉरेन वर्ल्ड होती है लेकिन उसके बाद आपको बाहर की दुनिया फॉरेन लगने लग जाती है आपको वो अपना सेकंड होम फील होता है तो उसके बाद जब मेरे लिए एक मुझे ऐसा जब मैं घर गई हूँ तो मुझे ऐसा लगता था कि जैसे मैं हॉस्पिटल जाऊंगी तो मुझे मेरी बेटी वहां मिल जाएगी तो मुझे अपने घर में वो घर वाली फीलिंग नहीं आती थी जितनी मुझे हॉस्पिटल में आ रही थी कि मुझे फील हो रहा था कि इससे तो मैं हॉस्पिटल में अच्छा थी तो ये चीज जो है होनी चाहिए बिकॉज के आपके एटलीस्ट एक लेटर या कोई जो है फोन कॉल जो है ऑन्कोलॉजिस्ट को जो प्राइमरी ऑन्कोलॉजिस्ट है उसको भेजना चाहिए तो ये एक बहुत ही एक अच्छा जो है ना वो फीलिंग आपके अंदर रह जाती है हमेशा के लिए
Yeah. Thank you so much. Thank you so much. And I have one question in the chat. Dr. Amar has a question that he said, my question to both, what you suggest healthcare team during treatment journey? For example, empathy, which is a core principle of pediatric palliative care, how they can incorporate as most are doctors and nurses in this forum. Empathy कैसे हम जो है वो incorporate कर सकते हैं अपनी practices में?
एम्पैथी तो आपके अंदर से आती है मतलब उसके अलावा जब आप जिस उसमें यही है कि आप जो है वो अदर साइड पे अपने आप को रखकर सोचे तो वो फिर आपके अंदर से ही निकलेगी और ये कि मैं जानती हूँ कि पाकिस्तान में बहुत ओवरबर्डनाइज होते हैं डॉक्टर्स भी और स्टाफ भी लेकिन ये है कि जो फैमिलीज होती हैं बहुत ही वल्नरेबल पोजीशन पे होती है तो आपको जो है वो आप अगर उनकी जगह पर उनको रखकर देखेंगे और जो उनके हर बंदे का एक अलग एक्सपीरियंस है, इंडिविजुअल एक्सपीरियंस है, जैसे मैंने अपना बताया, तो उसमें मुझे लगता था मैं सिर्फ वही एक ही हूँ जो कि इस तरह जो है फेस कर रही हूँ। तो अगर आप को स्टोरी पता है किसी की या नहीं भी पता है, सिर्फ यही पता होना काफी है कि उसके बच्चे को कैंसर है, और जब आपने डॉक्टर के बनने को या नर्स बनने को चूज किया है और फिर उसमें भी आपने जो है पीडियाट्रिक ऑन्कोलॉजी या नर्सिंग चूज की है, तो फिर तो एम्पैथी आपके अंदर से ही आनी चाहिए।
Thank you, Kiran. Thank you so much. Komal, would you like to add something?
Gee, I completely agree with what Ms. Kiran said. Empathy just I think it's natural. Like either someone has it or unfortunately they don't. However, I still think that as doctors or any healthcare professional, it should be part of formal training. And I really, really wonder if it is part of any such training, because we saw such a variation of doctors and like bedside manners that it was shocking, right? So I wonder is empathy and bedside manners part of training or not in general, or is it usually just medical things are taught and then this aspect of the experience is left onto the doctor's personality? But if it's not, it definitely should be.
Thank you so much. Do you have any question? यहाँ पे किसी का कोई सवाल है? So, any blaming part in family? Yes, thank you so much, Razi Rahman. He said that it's surely a role of parents helping others parents going through the same, and we are really glad to share this experience that we do have our bereaved parents who are sharing their experiences with other parents. So we will wind up our sessions. Thank you so much, Komal. Thank you so much, Kiran, for sharing your experience.
Thank you.
Thank you, Komal. Thank you. I'm always afraid of, like, I hope I'm not being insensitive toward bereaved families. It's like very core to me. Thank you so much, and I hope we get to learn from your experiences, and we will be definitely applying some empathy related attitudes in our practices. I would like to mention that I really appreciate the effort you are continuing as a legacy. Kiran is continuing Mahveen's legacy by creating a Facebook page with Mahveen Ki Mama, where she shares her experiences, she had with Mahveen and whatever she feels like to share her experience, and how Komal is continuing legacy of her husband through creating a brain tumor foundation. So your efforts are really appreciated. And once again, thank you so much for sharing your experiences with us.
Thank you very much for inviting us. Thank you, Ms. Kiran.
I want to suggest something
For
empathy के लिए, for the healthcare providers के लिए. Because empathy comes from inside, as she already told, ठीक है. तो होता ये है कि जैसे healthcare providers when they're seeing lot of patients like oncologists, ठीक है ना, तो वो क्या करते हैं, patient देख देख के जैसे everyone has the same thing, okay, but for the patient they are going through severe pain. They don't understand how the patient is going through, and sometimes they say blankly lot of things. Maybe this is a reality that she will die in 2 months or something like that. But for the patient, accepting this is a big problem. Healthcare providers are overburdened. I know, I understand, but sometimes they also need counseling. They get burnout, so they also need counseling so that they can have this empathic. They have empathy to the patient also.
Yeah.
So they also need counseling. The healthcare providers also, they need a break also, because sometimes seeing patients and then they get burnout also for that. And
Right.
also when we see any patient, if we think that if my mother, if my son is in that place, so फिर वो आप में empathy आएगी. Otherwise, you will see the patient as a normal person.
Right.
Empathy has to think multiple times what you're talking and how you can talk to the patient.
Right. Thank you so much for sharing your suggestion. And I think this is very important, that how we as a healthcare team are connected with our own grief and how we are dealing with our grief, because we also see, because somehow we also get connected to the patient and the family. So, and we are seeing our patient getting loose or, passing away. So that this really impacts us, but we are second survivor, maybe we are secondary basis to impacted. So yeah, that's very good point.
I'd just
Thank you
like to add just to that point that actually you're right, like the medical professional or the doctor shouldn't feel like they have to do everything. The burden shouldn't be on completely on them. And I think, at least in our experience, it was completely on the doctors, and that's expecting too much. They have so much more to do, right? So that I personally feel like that's where these psychosocial groups or the foundation like I've set up or support groups or that's where these organizations should step in because they're meant to take the burden away from the doctors.
That's really good. Thank you, Komal. So I hope most of you guys responded on the poll. Please respond to poll and we will end our sessions. We will be meeting inshallah in our next sessions that is about So should I end this meeting? No, I haven't. Hang on.